Dr. Baumann, thank you so much for joining me. This episode has been a long time coming. You were one of my dream guests when I thought of this podcast. So to be able to pick your brain a little bit about skin type and cosmeceuticals, I'm just so honored that you took the time out of your schedule to be here.
It's so great. We've been working together for years, and we always talk about doing this, but we're always so busy. So I'm glad we finally found time to do this.
Yes, me too. And I always like to start every episode by asking my guests, what is your first skincare memory?
Wow. Well, when I was really young, I lived in Texas. I was in a very dry climate, and I used to have eczema over here. I had like a red ring around my mouth all the time. So I remember using Vaseline on my upper lip, I had painful skin. I think that's what got me so interested in skincare in the first place, was this eczema that I had. So I think Vaseline would be my first one.
It's funny because it's always either an experience with a mother or a grandmother or an experience with their own skin, like something like acne or eczema, something that popped up in their younger years that kind of started to drive this interest in skincare. So I love hearing everyone's answers to that question.
The other thing I remember is Seabreeze. Anybody in my age group probably remembers Seabreeze. It was this toner with witch hazel and alcohol that had this clean smell, and we all loved it. And it was so wrong for my skin type. It's exactly what I shouldn't use, but we all used it. We all thought it was so cool.
I think that's a common theme. Skincare in general, especially in our teens and 20s, we're all using the same thing. And we're going to get to this later, but so much about skincare really depends on your skin type. Everything about skincare depends on your skin type and how you're going to tolerate the product. So we're going to get into that. But you have a really impressive career. So I'm wondering if you could tell the audience, there's a lot of med students listening, a lot of people interested in dermatology. Tell us a little bit about your early career and kind of how you got here, and maybe there's been so many, I don't want to say pivots, but you've expanded your career so much from just being a clinical dermatologist. And I'd love to hear a little bit about that journey for you.
Sure. Well, when I was growing up, I always loved to read, and I would read business books all the time. And so really the only female CEOs at that time were in the skincare industry. So I loved to read about Elizabeth Arden or Estee Lauder and Helena Rubinstein, and I knew everything about them, and I would collect skincare compacts. I have old soaps. I have a whole great collection of old skincare, as you know, because we work together. So when I became a dermatologist and I was about to graduate from my residency and I was trying to figure out what I was going to do, I thought I was going to be a pediatric dermatologist because I had this fascination with eczema because of my own background. So my boss saw this lecture by Dr. Alistair Carruthers, and he was lecturing on something called Botox, and everybody thought it was crazy that you were going to inject a toxin to get rid of wrinkles. And I heard there were 5 people in the lecture, and my boss was one of them, and he came back, and I was a graduating resident, and he said, I would really love for you to join the faculty and be my cosmetic dermatologist. And I said, cosmetic dermatologist, what is that? There's no such thing. And he said, well, you have this interest in the cosmetic industry and in skin creams and everything. I think you would be great at it. And I said, well, but that's really just chemical peels and leg veins. You can't just specialize on that. And he explained to me what botulinum toxin was and why he thought it might being a big deal. And so because I had read so many business books, I said, I'll do it, but I want to be the director of cosmetic dermatology at the University of Miami. And he started laughing and he goes, okay, but I'll give you that title, but you're going to be the director of yourself. And he started laughing. And we ended up building that into the biggest research center in the world, actually, for cosmetic dermatology. And I ended up doing all the toxin trials, all the filler trials, anything injectable like Kybella. We still do research today, as you know. But what's interesting is I wanted to look and see what was available out there at the time. So I started making an outline and looking up patents, and there really wasn't very much stuff. But that research led to the first book ever written on cosmetic dermatology, and this is it. And still the best-selling cosmetic dermatology book in the world. But I wanted to show you, look how skinny it is, because I didn't have much. There was nothing to talk about. And in this, Botox is only talked about for the glabella, and it had just gotten approved when the book came out. And at the time, nobody knew what it was. So this was kind of the book that introduced that to everybody. Now it's on its 3rd edition, and I wanted to show you just I don't know if I've ever shown you how funny the progression is. This is the second one, 2002. And they did these cheesy covers at the time, but you can look how much fatter it is.
Yep.
And then now the latest one came out. I got them to do it in black again because I like that better. And look, it's so much fatter. And then we didn't have room for all the cosmeceutical stuff, so I actually had a different book on cosmeceuticals that I wrote because we didn't have room to put it in there. So that just shows how much the field has grown. And so really I was in the right place at the right time with the right boss that I listened to. And it's been amazing to watch the field change from being the only one doing this to having a med spa on every corner.
Yeah.
So I used to be trying to teach people how to do things. Now I'm trying to teach people how to know who to go to, who's safe. And, you know, there's so, as you know, so many fake toxins out there and bad injectors and problems. So what a difference from nobody doing it to everybody doing it.
And I want to touch on this because the cosmeceutical book is my personal favorite of the books you've written, just because it's so in-depth on skincare ingredients, which is truly my passion. But how do you approach the patient or someone that you're educating who doesn't put two and two together when it comes to cosmetic procedures and skincare? Because I find this a lot in the industry on social media when there's experts talking about things. I'll see in the comments that they're almost getting hate or accused because they also do cosmetic procedures. So there's this rhetoric of, you know, well, how can you possibly talk about ingredients when you're doing Botox? But we know that they do two completely different things. So how do you educate even a patient who comes in who maybe they're just interested in doing procedures, but they're not interested in skincare? How would you have that conversation with them and why both are important if they decide to do cosmetic procedures?
Well, I like to explain to them, it's like, let's say we're talking about weight management and you want to go to a health spa. So you want to go, let's say you're going to go to Canyon Ranch and you're going to go and you're going to eat right and you're going to work out for a week. And then you're going to go home and you're going to eat wrong and do everything wrong for the rest of the year. That's what it's like when you get a cosmetic procedure like Botox or fillers and you don't do the right skincare. Doing the right skincare every day is equivalent to eating right every day. So just like medicine is food, proper skincare is also medicine.
Absolutely. And then throughout your career, as you gained this understanding of cosmeceutical ingredients, which at the time and even still now in residency, they're not taught a ton about topical skincare, right? Beyond like the CeraVes and the La Roche-Posay's. So at what point did you realize that there was a need for more consumer education, and when did the idea of Skin Type Solutions come to you?
In about 1999, I started writing a column for a dermatology journal. At the time, it was called Skin and Aging, and then it was called Skin and Allergy News. Now it's called Dermatology News. It was always the same. So for 25 years, every month I've written about ingredients because a lot of dermatologists were asking me about what does this do? What does that do? And that's what ended up turning into this book, this cosmeceutical book. That's all my old columns rewritten and put in here. And when we were residents, we didn't really learn much about skincare at all. So it was around that time, probably 1999, that I started realizing that people needed to know more about skincare. So in 2004, I was at the University of Miami, and I had patients flying from all over the world to come get skincare consults with me. Wow. Because they would see that I had written all these things about skincare. But I'm at a university, they won't let you hire more people. They're pushing you to see more patients per day. And to do skincare right at that time would take me 45 minutes a patient because I had to ask them a lot of questions about their history of what products bothered them, what kind of skin issues they had. It's not about looking at somebody's face and seeing a pimple and giving them an acne medicine. There's so much more to it than that, knowing what breaks you out, how you react to cleansers, and all of that. So it would really just take me too long to do the consult. And they were pushing me, see more patients, see more patients. I had a mentor that said, you should spend an hour a week of thinking time. And it's great advice to just sit there for an hour a week and think about, you know, your job and your life and everything, and you'll come up with good ideas. Mm-hmm. So I was sitting there thinking, how can I make my practice go faster? How can I be more efficient? And what do I think about with patients whenever I'm trying to design a skincare routine? And I realized that there are 4 main things I think about. And the first one is if their skin is hydrated or not and how much sebum they make. So are they oily or dry? And the second thing I think about is do they have inflammation or not? And if they do, is it acne or is it rosacea? Is it stinging? Is it uncomfortable skin? Is it allergies? Like, do they have inflammation? The third thing is their skin pigment even, or do they have lots of little brown spots that you need to lighten? And the last one is, do they need anti-aging? So I'm sitting there thinking this, and I look over on my shelf, and I see my Myers-Briggs personality test book, which I love the Myers-Briggs personality types. And they're based on these 4 things, and you mix them and you get 16 personality types. And I had that aha moment where I thought, this is what I'm going to do. I realized these are 4 important things, and so I divided people into 16 types. So then I could pre-decide what the regimen was going to be. So after I spent time with the patient, I would figure out their skin type, and I would already know, okay, here's your regimen. So then I realized that I wanted my staff and other people to help me, but if they didn't diagnose the skin type properly, it wasn't going to work. So if one of my nurses gave somebody the wrong regimen because they were wrong about their skin type, it would still be a problem. So I realized that I had to come up with a diagnostic test, and that's what took the most time. It took years to validate that. And once I had the test, and then I had the 16 skin types, I had 16 sheets of paper that I would give my patients. So if you're this skin type, here's this sheet of paper. And that's confusing. We had 16 folders. This was before computers and digital. So I thought, you know what, I should just put it in a book. So I ended up writing the skin type solution, and it was surprisingly became a New York Times bestseller. I mean, it was really just to make my practice go better, but people loved it. And here, this is the original hardback that was the New York Times bestseller. And what you would do is you'd take the quiz in the beginning, and you'd have to hand score it, and you get your little score and go and find your chapter. And then we would have, let's see if you can see us here, $1 sign, $2 sign, and $3 sign.
I love
choice.
that.
Yeah, this is 2005, so you're probably you were probably in middle school when this came out.
Yeah, I was in elementary school.
So what would happen is it takes a long time to get a book published. So by the time the book came out, people loved it. But the problem is, by the time the book came out, the company changed the name of the product to something else, or they changed the formula. So it was impossible to keep it up to date. So that is why I ended up doing the online site, so that I can change it. Right now, I could go change it if I needed to. So it's so much better than a book where you're really just stuck with it until the next publication. But it showed because it was a bestseller, it ended up coming out in 8 countries and many languages all around the world, and people loved it. And it showed that there was a need for people to know their skin type and that people wanted good advice. Then we had a forum. It was before Reddit, pre-Reddit. It was a forum at skintypesolutions.com, and we had 6 million people, 16 different forums, and you could go talk to other people with the same skin type as you. And this is when people were first starting to use Google search. And I wrote for Yahoo at the time, who was huge at the time. I was their health blogger. So people would go from Yahoo to this forum and talk about skin types. So let's say you are a DSNW skin type like me. You could talk to other DSNWs. And if you said, I hate this product by X brand, when somebody would Google that brand, that would be the first thing that would come up. This was before people did SEO and all that. We just had so much traffic. So the brands would call me and they would say, we will pay you to take that down. But we wouldn't do it because we wanted this to be a place with open, honest exchange of people. And that was very, very interesting. Then all the spammers started learning how to spam the forums, and all these Viagra ads would pop up, and it was such a mess, and they didn't have all the ways to block that. So we finally turned that off, and I'm thrilled to say we're restarting it on Reddit. In the next couple of weeks, it's going to be a subreddit, Skin Type Solutions, and people will be able to come talk to their skin twins, which is other people who have the same skin type as them. So we'll be able to go back to allowing people talk directly to each other about their skin and talk to people who have the same skin type that they do.
And how important is skin type when it comes to picking your skincare? Like, what are some problems you see with new patients who come in who are using the wrong things, and maybe something that's easily mitigated just by knowing your skin type?
So skin type is critical for so many reasons. I'll give you a couple of examples. One is there's sensitive skin types and there are resistant skin types. So resistant skin types, have a stronger skin barrier, and it's harder for things to get into the skin. So the resistant types are usually people who say, skincare doesn't work. I've tried everything. I can't tell the difference. None of that stuff works. And there are many people out there. And the reason it doesn't work is it doesn't get into their skin. They're not using strong enough things. They're not using in combinations of products that enhance absorption and penetration and really make things work. And the reason that they have trouble finding products is companies don't want things that are going to really irritate you and be too strong and all of that. So without supervision of a professional, people can get irritated and get rashes, and that's bad for the company's brand. So companies tend to not make products for resistant types as much because they want to avoid that. So it's hard for those types to find good, strong products that work. Meanwhile, you have a sensitive person like me, where I get a rash from everything. I'm a great beta tester on skincare because if I'll break out, I'll get red, I'll get allergic. So those are very, very different issues. Same thing when you think about oily versus dry. Oily people have a lot of sebum and oils and fats on their skin that keep things from penetrating, and they get their pores clogged, and those oils will inactivate different things, while dry people will have an impaired barrier and not a lot of water in their skin, so things are going to get in better. So every one of those 4 issues, I call them the barriers to skin health, which is dehydration, inflammation, uneven pigmentation, and aging. Those 4 barriers to skin health dramatically affect what products you need and how products work on you.
It's so interesting because oftentimes, obviously we employ this entire system in the office. So when a patient comes in, before I even see them, I have a good idea of what the regimen is going to be, right? Because it's all done for me, which I think is a reason why the system is so beneficial for providers, especially providers looking to get into the space, because it's done for you in a scientifically backed way. But I always find it so interesting when patients come in, and especially my acne patients, and they say, well, I failed this medication, I failed this topical, this didn't work for me. And when I talk to them a little bit more, what I find out is that actually they were just given zero guidance on how to use it and what to use it with. And of course, if they have a sensitive skin type, which most acne patients do, they're not able to tolerate an acne active without the right cleansers, without the right moisturizers. And, the provider they were with before said, oh, just go find whatever off of CVS. You can use anything. And we know that that's not true. We really need to understand the skin type, and everything down to even the cleanser that you're using matters.
It's so true. So we have over 250 medical practices, mostly dermatologists, who use the system and the software in their office. And the number one thing I hear back from the doctors and the providers that use the system is that they cannot believe how well people are responding to their acne medications, because they're not used to spending the time telling them what cleansers and what moisturizers are going to work best with their medications. So that is the first thing that dermatologists notice when they use the system, is fewer callbacks to the office, fewer complaints, better compliance. So we've really tracked this, and that's one of our biggest selling points, is people will use the products when they can tell that they work and they get better results. So the goal of my company, Skin Type Solutions, is really to improve skin health around the world by helping everybody find the right products to use and to help them be compliant and consistent, because correct, consistent compliance is really, really important to get good outcomes. And so we have all these offices using it online. We started doing that in 2014. We started letting doctors use it. But then during COVID, when the practices were closed in 2020, the doctor said, please let us do this online. So it was 2021, we started allowing people to take the quiz online without a doctor or a medical provider. So now you can go directly to skintypesolutions.com and take the same quiz that doctors use and all of the medi-spas that use our system, and shop using your skin type. So that's the exciting thing, is once you take the quiz and you know your skin type, you get a little octagon with your skin number and color, and you can shop using your skin type. So you just scroll through the products, and if the octagon is next to it, you know it's right for you. So we took this from, I guess it was exclusive in doctors' offices. What would that be? 7 years exclusive in medical practices. And now anybody can use it. So we're so excited.
It's so fun to know your skin type. My favorite is when I have a patient who comes in that happens to be my same skin type. I'm always like, oh, you're a DSPW just like me. And then I, give them the whole spiel. But I think it's fun for them too to be like, wait, we have the same skin type, especially because usually they're coming in at the beginning of their journey where I'm down the road on my journey. So it's cool for them to see what progress they could potentially make. But do you find that this issue with skin type has escalated now that we have social media and people sharing all of their skincare routines and people with millions of followers recommending products as if they're good for all skin types, which of course we know there are very few products that truly are made for all skin types. That's kind of a marketing term that these brands will use. Have you found that this issue has been escalated since social media started?
Yes. So it's always bothered me that there is no such thing as one cream or one product that's right for everybody. The brands would love for you to believe that this product is right for everybody, but that's just not the case. But now that people are getting paid to say in different posts that something is good, it's out of control. So we have a new campaign going on saying, don't take advice from somebody who doesn't know your skin type. Because if I just walk up to someone and say, hey, you should use this moisturizer without asking them any questions about their skin, even being a dermatologist, I can't look at your skin and know immediately what your skin type is. That's why photography is useless. All these apps that take a picture of your face and tell you what skincare to use, that's ridiculous. That doesn't work at all. What if you had 5 pimples last week and now you have none and the picture thinks you don't have acne? So it's not accurate to just look at a picture. So it's made such a difference. So when I go on social media and I see people pushing products or saying, look at my regimen is great, they never say what their Baumann skin type is. So I think that if you don't know what the influencer's Baumann skin type is, then why are you taking their advice? They might be different. They might not be your skin twin. Now, with you, you've worked with so many different people. You know all the different skin types. You've got this intimate knowledge of the skin types, and so do I. It's different. We can talk more about this is for if you're this skin type, this is for your that skin type. But most people are just saying, use this product. It's great for everybody. And not only is the product maybe not right for you, but it's probably a product placement ad, and it might not even make a product at all. I have been shocked at some of the terrible products that are being pushed, like retinol palmitate, which is one of the worst retinoids out there because when you go in the sun, it can become cancerous. And right now on Reddit, everybody's talking about these retinol palmitate products, and I'm like, I guess they weren't around 10 years ago when we all quit using it because it was bad for you. And now all of a sudden everybody's using it again. So it is out of control. There's a lot of bad advice out there. And that's why I'm so proud of you. And you're doing so well, giving all this great advice. And it really makes me happy that we have people like you out there who know what you're talking about, who do this in your daily job, giving really good, accurate advice. So thank goodness.
Thank you. And it's funny because I get the question a lot, like, how did you get this knowledge? And of course, I was lucky enough to be in clinic from you and hear it straight from the horse's mouth. But I do always share your textbooks because I still refer to them today. Like, they're invaluable. There's so much information. Your blog has so much information. STS has so much information. So of course, we'll link all of that down below. But we had a couple of listener questions that came in that I would love to get to. And one of them is, and this person obviously is very familiar with Baumann skin types because she said, what about combination skin? So I'd love to hear your take on quote unquote combination skin.
So there's really no such thing as combination skin types. In the 16 skin type system, it is designed for you to figure out what kind of skincare products you need. So if you think about what people are saying when they say combination skin, they're usually saying that they're oily in the T-zone and they're dry on the sides of their face. But they also might be saying that they're dry in the winter and they're oily in the summer. So really, the people who are dry in the winter and oily in the summer, what's really happening is they're changing from one skin type to another. They're a dry skin type in the winter and they're an oily skin type in the summer. So those people need 2 different regimens. If you're using one product that you think is going to work all year round, or one regimen that's going to work all year round, then you're never really getting the right regimen. Really, you need to have your dry regimen when you're dry and your oily regimen when you're oily. As far as the T-zone oily people who think that they're combination, they're really oily types because they're making enough sebum in their T-zone. And sebum is an occlusive. It helps you hold on to water. So they're actually making their own occlusive moisturizer. So they don't need a lot of occlusives in their moisturizers. People who are dry need occlusives. So that's why if you have an oily T-zone, you're considered an oily type. If you don't, you're considered a dry type. And the reason people are dry is when their barrier doesn't work well and they don't hold on to water very well. So it's interesting. If you have a defective barrier and you don't hold on to water very well, but you make a lot of sebum, you're still considered an oily type because your sebum is like putting Vaseline on your face. So you're making your own moisturizer. So if you make a lot of sebum, you don't need heavy oil-filled moisturizers. That'll clog your pores and cause problems. So I wish people wouldn't use the term combination skin because it's not a real thing. Dermatologists don't use that. You don't see that in textbooks. It's not a real thing. So really you're oily or you're what's called a changing skin type. So you just have to figure out which one of those you are. And if you don't know, you just take the quiz. So people who think that they're combination types, I have them retake the skin type quiz seasonally and they'll see that they alternate. So if I was that changing type, that means I would be a DSNW in the dry months and an OSNW in the wetter months. And so you just have this OSNW regimen and a DSNW regimen. But it's actually, when we look at the numbers, it's not very common. Most people fall into one or the other. It's very unusual, actually, to have a true type that changes off and on like that.
I was going to ask you that, how often you see a skin type that truly changes. And of course, here in Miami, it's very humid, but we have a lot of patients who go to places like Aspen or on the West Coast where it's very dry. So I do find more with those patients that we have to adjust their regimen a little bit, which
exactly.
is, I mean, you can't expect your skin to always act the same.
Right. So in Aspen, they'd be a dry type, while in Miami, they're an oily type, and they have two completely different regimens. And it's better to do that than to try to have one product work not as well for both.
Yeah, exactly. And I want to touch on the barrier a little bit because the damaged skin barrier, impaired skin barrier is a really hot topic right now, but you've been talking about it for decades now. So what is your approach to someone who has quote unquote a damaged barrier, and what might that look like? What are some warning signs of a damaged skin barrier?
People misuse the term skin barrier, first of all. They use skin barrier to mean keeping out bacteria, preventing things from penetrating into the skin, all kinds of things. But the true traditional meaning of the skin barrier is the fats that surround your skin cells, kind of like saran wrap. You know when you put saran wrap on food and you put it in the refrigerator and you see all the condensation underneath the plastic? Think of that as what your skin barrier is. It's these lipids inside your skin cell, around your skin cells that keep water inside and keep water from evaporating off of the skin. And some people are genetically deficient in those lipids. That's what eczema is a genetic deficiency of the skin barrier. So if you don't have these lipids, that they have to come together in a puzzle piece pattern like this. So let's say this is how your normal barrier is, but genetically your lipids are not right. So you have holes like this. Water can get through and evaporate, and that's what makes you dry. So your skin will look dry, rough. It might itch. It's allergens get in those little holes. Irritants get in those little holes. Your acne medications get in those little holes and irritate your skin. So the barrier really is when those lipids are coming together and they're watertight and they keep things from evaporating off. Now, the reason I make a big deal about the puzzle pieces is if I'm calling my fingers the lipids, the shape of these lipids change depending on what fatty acids are in the moisturizer. So stearic acid, for example, is a very common moisturizer. It's in cocoa butter and anything that has stearate, like cetyl stearate on the label. You'll see all kinds of things with stearate. That's stearic acid. And fatty acids have a head and two tails. So the stearic acid tails are really straight like this. So they pack together really good to block those holes in your barrier. But if you look at oleic acid, which is an olive oil, those little tails are like this. So they line up like this. So you still have holes. So oleic acid isn't as good for your barrier as stearic acid is. So what lipids are in your moisturizer is really, really important, and people don't understand that. And so not only is it the kind of fatty acids, but you need an equal ratio of fatty acids, ceramides, and cholesterol, because those give the three-dimensional puzzle piece that makes it airtight, like I was talking about like this. But this is 2D. Imagine this in 3D where everything, really has to fit together. Now, when it fits together perfectly and you look at it under a cross-polarized microscope, it makes this cool pattern. The light hits off of that puzzle piece in a pattern called the Maltese cross. So we can look at a moisturizer under the microscope and see if it's good for your barrier or not, if it has the Maltese cross pattern. And most people don't know that. So we actually did a study where we compared La Prairie and Creme de la Mer and Drunk Elephant and Xerify and Medicure and all these and looked at the Maltese cross pattern. And Xerify was the best and Medicure was the number 2. And it's really, really fun to go look at those pictures. I have them in my blog called The Maltese Cross Pattern, and it explains all the physics of that if people are interested.
We'll link that below because I find that topic to be so fascinating. And I think if you're someone who's really struggling with an impaired skin barrier, just getting on the right products, like Xerify is the one that we use in office most commonly, is such a game changer.
You know what people don't understand about Xerify is it is a Korean moisturizer. It was a Korean moisturizer before Korean skincare was even cool because a lot of people in South Korea have really advanced technologies. Mm-hmm. So they came up with this whole idea of the Maltese cross pattern in South Korea a long time ago. But now everybody's trying to say that they are Korean skincare.
Isn't that funny how it all just comes full circle? And I do want to touch on cosmetic advancements, ingredient advancements, because one of the questions was, what do you see coming down the pipeline when it comes to ingredients? And I know this is tricky because there are some tried and true ingredients that really top everything else and have for decades. We just have so much research like vitamin C, like retinol. But what is coming down the pipeline or maybe new in the last few years that you think actually has some merit as far as ingredients go?
Well, I'm obviously a little bit of a science geek. I love reading science and nature and all of that. A couple of weeks ago, did you happen to see the paper on IL-11?
No.
So it's going to change everything.
Sounds exciting.
So growth factors and cytokines are cell signals of, I know you know, I'm just telling your viewers, but growth factors, cytokines, and interleukins are all cell signals, and that's how cells talk to each other. And there's one very important in inflammation called IL-11. And they found that if they block IL-11 in mice, they live 25% longer. So that gives us huge insights into the aging process. And another aspect of that is called senescent cells. So when cells are young, they're like stem cells, and then they change and they differentiate and grow up and start acting differently. And then when they get older, they go into this process called senescence. And I joke it's like an old crotchety person who complains to everyone all the time. That's what a senescent cell is. It just lets off all these cell communicating factors that bother everybody and cause inflammation. And we know that how much you age is directly associated with how many senescent cells you have. And I have a blog on cellular senescence if people want to know more about this. But our goal in skincare now is trying to get rid of senescent cells. And you do that through a process called autophagy, which means eating itself. The cells learn with ingredients to eat up these old cells that you don't want there anymore. So that is really the big push right now in ingredients in skincare, is upping autophagy to get rid of senescent cells. And lots of scary looking words, but basically, let's get rid of all the crotchety old cells that aren't doing anything and make way for these younger cells that are going to come in and act young, and that revitalizes your skin. So there's many, many things that are being looked at right now. The most exciting right now to me are the exosomes. And I like the platelet-derived exosomes because platelets are involved. When you cut yourself, platelets go into that wound and release all these communicating factors to tell your wound to make more collagen and heal. And that's the same thing we want when we're trying to fix aged skin. So platelets have the right signals. They know what to say to get your skin to rejuvenate. So that's why I prefer platelet-derived exosomes. There's all kinds of exosomes out there, but don't waste your money on plant-derived exosomes. We don't need plant signals. That doesn't help our body. You have to think about where this stuff is coming from. Like those apple stem cells, remember those? I mean, we don't need apple cell communicators in our skin.
Are there any brands that are already doing this, or is it something that's coming down the pipeline? If somebody wanted to tap into this technology today, is there anything you'd recommend?
Oh, sure. There are lots. Well, my favorite of the exosome products is Played It. and the plated and tint serum. They just came out with an eye cream, but it's already sold out worldwide. You can't get it. I actually have one. I'm so happy, but it's hard to get that. But the tint serum is platelet-derived exosomes, and the results have been amazing in my patients who... The thing is, if you already have great skin and you start using it, it's hard to tell the difference because your skin's always great. But people who have older looking skin or crepiness or discoloration, and that it just has that older texture, they notice a big difference. And then as far as cellular senescence, the Xerophyte Wrinkle Defense has lots of different ingredients in it that target cellular senescence. But a lot of things target cellular senescence now. So that's why it's better if they go read my blog, because I have a list of ingredients. They'll have these long, crazy names that you can look for on an ingredient list that will help target cellular senescence. Now, if you're 20, you don't need to worry about this yet because you don't have senescent cells. You're going to start getting your senescent cells probably in your 50s. So, have you tried plated yet? I bet it doesn't really do much for you.
Yeah, I've tried it, but it's one of those things. I'm very consistent with my sunscreen, my retinoid, and my retinol, or my retinoid and my vitamin C, and I don't stray from that a lot, right? Because of exactly what you said. And I love that you mentioned that because this is how I explain. There's a hair treatment called K18 that helps repair broken disulfide bonds and polypeptide chains, and I explain it as because it's $70. Everyone's like, this is so expensive for a hair product, but I'm the way I explain it is you have to weigh how much it's going to benefit you. The more damage you have, the more results you're going to see. And it's the same with some of these more expensive tech products where the tech is really new and those cosmeceutical ingredients. You have to weigh at what state is your skin in right now. Like you said, if you're 25, you're not going to see a difference from the serum. So wait a few more decades until it's really going to benefit you. But if you are someone who's seeing that crepey skin, and you feel like you could use a lot of help, then it is worth the investment, right?
Right. And this is a reason you need to take the quiz at Skin Type Solutions, because people try to guess on their skin type or their skincare, and over 80% are wrong. And a good example is you and I are both DSNWs. We just figured that out. We're skin twins. But if we just guessed that and didn't take the quiz, it wouldn't know that I'm older than you. So by taking the quiz and putting in the answers to all the questions, it knows a lot about me, and it would give you and I different skincare. I'd be more likely to get the exosomes. You're in a different phase. You're in the phase where we want to keep your skin looking as it is. Your skin is great, so we want to give your skin enough vitamin C so that it can continue to make collagen, and we want to give it retinoids so it doesn't make collagenase to break down collagen, and you want your sunscreen to protect your skin. So you're in a stay as you are phase of your life. I'm in a try to get all these little wrinkles to go away phase. Are very different. So the products that are right for me are going to be a little bit different than what's right for you, which is why taking the quiz really matters. There's also 4 kinds of sensitive skin. So just because you're a DSNW doesn't mean you're exactly the same. So I'm a DSNW redness type. You can kind of see I'm a little red. I'm always a little red. And every time I try out a new product, I'm such a good beta tester because I'll flush red from it, while other people might get pimples every time they use a product. So the quiz knows a lot more about you than you realize. So it's very, very, we spent years validating it, and with many studies. I like to tell people to go to Google Scholar and put in Baumann skin type and look at all the publications. Look how the researchers around the world are using the 16 skin type system. It is what people in the industry use. And I find it very interesting that on TikTok, for example, nobody's saying, hey, I'm this Baumann skin type, so these are my recommendations. So if I could get everybody to tell what their Baumann skin type is before they give advice, their advice would be so much more meaningful. So that's really my outreach and my purpose of doing the podcast today, is to say, please know what your skin type is. And please insist that the people who give you advice know what their skin type is, so you'll know if you're skin twins or not.
That is, I think, such a great note to wrap up on, because if we could all get that information from our favorite influencers raving about their Holy Grail product, it would make it a lot easier for us to make an informed decision.
So much easier. So that's why I say don't take advice from someone who you don't know their skin type and they don't know yours. Unless it's somebody that's trained, like a dermatologist or someone like you who's worked with a dermatologist for years, who... By the way, everyone, Amy is one of my top skincare people in our practice. She's the one everybody wants. When she went on maternity leave, everyone was just calling every second. Is she back? Is she back? Is she back? She's amazing. I'm so proud of her, and she really knows a lot. So keep in mind that not everybody is trained like she is. Not everybody reads like she does, and not everybody knows what she does. So you really got to think about the qualities and the knowledge of the person you're getting advice from, because I hear terrible advice all the time. My friends and my team want me to do the TikTok videos where you do the stitch and you go, oh, that person's wrong.
Yes,
but
you should.
And everyone's wrong. Or I just didn't want to be that negative person that goes, that one's wrong, that one's wrong, that one's wrong. So I'd rather go, Amy's right. Amy's right.
So
you
funny.
can trust Amy. But I wouldn't really trust 99.9% of the advice you're getting out there, even dermatologists. Listen to this. Last week, a dermatologist on TikTok said that skincare doesn't work unless it's prescription. Hello? Can you believe that?
Which has been disproven for decades, right? We have tons of clinical data on retinol and all these ingredients that are in these cosmeceutical products that don't need prescription.
So you know what I think? I think she's a resistant skin type, like we talked about at the beginning of the interview. And so she's not using over-the-counter products that are strong enough, and that's why she thinks it doesn't work. She doesn't know her skin type, and she's not using the right things. If she took the quiz and knew her skin type and used that, she would all of a sudden realize that skincare does work. It's a perfect example of somebody not knowing their skin type. I do research. I've been doing research for years for companies, and absolutely skincare works. If you use the right products and you're consistent with them, they absolutely work. And I can even treat some medical conditions like acne and rosacea and melasma with over-the-counter stuff. It's just a matter of matching it to the person.
Understanding the skin type, and as we mentioned earlier, knowing how all those products work synergistically, your cleanser with your moisturizer, with your serum, with your sunscreen, with your retinoid. It's all, and that's why the quiz is so helpful, and the routine that the quiz spits out for you is so helpful, because all those little minute details are taken into account in a way that most people who are recommending skincare don't think about.
Oh, can we talk about that for a second, the routine step order?
Yes, please. That's always a common question.
Oh, huge question. And that, people will put products up and say, what order should I use these in? Well, the answer is it depends on your skin type, again, because every product affects the products that are on your skin. And the way I like to explain it is, if you think about when you take yellow and you take blue and you put those together, it makes green. That's how it is when you take two skincare products and you put them together. It makes a third product. All those chemical reactions that happen, so it's not the same. They all affect each other. So one example is hyaluronic acid. Hyaluronic acid increases the penetration of everything else. So if you're using an acne medication like benzoyl peroxide or Retin-A, and you cover it with a hyaluronic acid moisturizer, you're going to increase the amounts of retinoid that get in your skin, and you're probably going to have more side effects than if you didn't use a hyaluronic acid moisturizer. And that's just one example that we see all the time. So the order that you use things matter. So your cleanser, it might be a low pH cleanser like glycolic acid or salicylic acid. So you put that on, it lowers your skin's pH. And then if you need to use a vitamin C serum, vitamin C serums go in better when the skin's a low pH. So that would be great. Let's say you use a creamy bar soap, a bar soap or a creamy cleanser. That raises your skin's pH. So if you use a creamy cleanser, then you put vitamin C on, not as much is going to get in. So everything gets affected by things like pH, the other products in there. Did you know that there are some cancer-causing chemicals that are not in skincare products, but when you use two ingredients together in a skincare product, it turns into that? So by layering two wrong things together, you can be causing a product, causing a ingredient that causes skin cancer. So it's so important what you use, what order you use. And I'm not saying that you have to use products all from the same brand, because I don't believe that at all. I think you take the best of the products from the different brands and you combine them, but you need to do that in the right order. And that's really the specialty of Skin Type Solutions, is you take the quiz, you find out your skin type, and then you get to combine products from many different brands. And we help you build the regimen in the right step order so that you don't have to know any of the science. It's all done for you. And even the dermatologists in their office who use it, they don't even have to think. They just have the patient take the quiz. It generates a regimen for them, and they can have the comfort of knowing that the science is right and the patient's going to get a good outcome.
Absolutely. And we've seen it time and time again with our patients in clinic. There's nothing more rewarding than somebody coming back in 4 to 8 weeks and just being transformed. I mean, it's such a good feeling. And when I first started and I knew nothing, I was so green, I had that confidence that whatever the STS system told me to prescribe to that patient or recommend to that patient was going to be effective. And that's what gave me the confidence, was seeing them come back over and over, understanding it was working, and then, understanding why it was working. So it's just a great system. And we'll leave a link below. Like we said, now that everybody can take it, you don't need to go to a doctor's office to take the quiz and get the recommendations. We'll leave a link below. And I like to end every episode asking, if you could tell your younger self one thing, what would it be?
Well, I don't know.
Hard question.
I was good about wearing sunscreen. I know what I would tell other people. I would tell other people, wear sunscreen, always wear a sports bra when you're doing dance class and stuff so your breasts don't sag. Use your retinoids all the way down.
Yeah.
And luckily I did those things. So I don't think I would have done anything differently. Maybe I just would have stressed about it less. I would have realized everything was going to be okay. My career was so different because things were changing so much. We didn't know what cosmetic dermatology was. We didn't know a lot of things. And, if you believe in what you do, I've been working on skin type solutions since 2004. I know it works. The technologies have changed. The way people get their information has changed. Everything from we used to go to forums and now we learn on TikTok. But all that, you just have to believe that if you are diligent, you do the right things, you do it for the right reasons, that everything's going to come out okay. So find what you love and stick with it and do it right, and don't give up, and don't take bad advice from people. Make sure that you take advice from people who know what they're talking about.
Absolutely. Dr. Baumann, thank you so much for taking the time to chat with us today. I feel like we could have talked for 3 more hours because there's just so much information here, but this is such a great start for everybody. And like I said, I'll link everything that we mentioned below so that they can kind of check out all the other resources. So thank you so much.
Thank you. It's so good to see you on screen. I'm used to seeing you live.
Thank you.